Hello, my name is Gina Wells, and I am a graduate student here at OSU studying international agriculture. I will be discussing an organization that is a nonprofit 501c3 charitable public charity. The name of the organization is Palmetto Medical Initiative, and the home office is located in Charleston, South Carolina. The organization has sites abroad in Uganda, Burundi, and also in Nicaragua. Palmetto Medical Initiative is considered to fall into two subsectors: health services and international foreign affairs. The health subsector is the largest of all nonprofit sectors, which includes hospitals, health centers, blood banks, and disease organizations. International and foreign affairs encompasses organizations who work internationally and focus on community development and relief programming. Most of the work done by Palmetto Medical Initiative is done in a medical clinic setting and offers outpatient services, inpatient services, and health analysis in the international community. Before I move on, I just want to clarify that I may refer to Palmetto Medical Initiative as PMI. So the mission of PMI exists to transform communities by improving the quality of accessible health care through a model of empowerment and sustainability. Palmetto Medical Initiative is revolutionizing the approach to medical intervention in the developing world by moving beyond relief to achieve long-term improvements in health. The vision of the organization is to see impoverished communities take ownership in a sustainable healthcare model, so that they may become empowered to bring about long-term change and tangible improvements in quality of life. A little bit about the history of the organization. It was founded in 2008 by Matt Alexander and Dr. Ed O'Brien, who is a physician and a long-time medical missions director. Both of them had an idea and a passion to be able to help and treat underserved populations by creating medical centers abroad that would become self-sufficient and sustainable within a 24-month time period from start to finish. Both of them got their launched the initial site in Uganda in 2009, and since then, 24 months after their initial launch, that clinic in Uganda is now sustainable, and so they continue to grow and expand. Their second site was in Burundi in 2011, and now this year they're actually opening their first medical clinic site in Nicaragua. The purpose of the organization of PMI is very simple. It exists to provide quality, affordable health care to people in need. A couple of things that I would like you to know about the staff structure is that they have 4 U.S.-based staff. Matt Alexander, who is the executive director and co-founder of the organization. Michael O'Neill, director of international projects. He works directly with all of the international teams abroad and their local staff. Tyler McCoy, director of operations, and Katie McKenzie, director of volunteers. In each of the clinic sites, whether it be in Uganda, Burundi, or in Nicaragua, there's a large team of international staff, and that can encompass staff from whether they are nurses, doctors, nursing officers, lab assistants, groundskeepers, night guards, accountants, project coordinators. They have very large teams. Minimum of 15 staff are needed to run the clinics completely, and all of the staff are nationals of the country where that clinic is. Back here in the U.S., there is a board of directors, and that board of directors is part of what keeps the organization together. They are required to be involved as volunteers to work in all of the clinic sites abroad minimum once a year, while also committed to working closely, of course, with the executive director in making decisions, plans, adjustments to all of the programming and planning for the future, and also in the expansion processes. The board of directors is made up of 3 MDs, physicians, a lawyer, a minister, 2 accountants, and 1 dermatologist. regarding the partners that Palmetto Medical Initiative has, they have over 15 to 20 partners that work with them. A few of them, just to mention, is Peace Corps is one of their partners, the Citadel, College of Charleston, the Church of Uganda, Water Missions International, USAID is one of their partners, and even one of their greatest partnerships, where in the context where I actually was able to get to know this organization, is their partner Need to Breathe, which is a band who on their tour schedule actually some of the staff representatives travel with this band, and they do recruiting efforts to promote what is going on abroad with sustainable medical clinics. Volunteer functions, if you were ever interested in working with this organization or know of someone that has, basically the volunteer, their role is first of all to be a hard worker and to also believe that change is possible. Not just for the time that you're there as a volunteer, whether it's 10 days, 3 weeks, whatever, but for a lifetime. And so the short-term medical teams are a vital component of the long-term approach to improving the quality of healthcare in developing communities. Regarding the income structure and budget, the organization is funded through individual donors, churches, and medical networks, and donors contribute money to specific projects or general donations. They do have accountants on staff who handle finances, budgeting, salaries, and distribution of funds to the international organizations, the clinics that are abroad. In each of the sites abroad, there are accounting assistants and accountants who work to then divide the budget even more so that it will help the clinic function locally. When someone does partner with PMI financially, they can be confident that their donation is propelling and allowing the organization and the clinic sites to grow. 100% of the donation goes towards the goals of improving the quality of accessible healthcare across the globe. Something unique about the organization and why I am drawn to it. I had met the director of volunteers, Katie, last year, and actually at a Need to Breathe concert here in Stillwater last November 2013. And I had the chance to just talk with them and to understand their passion for service in the nonprofit sector and their desire to connect people locally with the vision and mission of the organization. And because of my experience working in management and leadership and in the nonprofit sector for over 10 years, I had a lot of questions that I wanted to ask them, and I really wanted to understand what it is that made them excited about the work that they do. And ultimately I learned in the short amount of time that I spent with them that the focus of their mission does not change. And I thought that was really important. I understood how many different kinds of partners they had and have, and even though they have many partners financially, they do not let the financial donors really change the direction or the mission of their organization. And to that, I highly respect them and highly recommend you to consider working with them someday. Thank you so much. And there's also a Prezi that coincides with this discussion. Thank you.